you everyone for joining me tonight. I hope that you'll be able to take some things from this presentation tonight to be able to apply it into your life and just make things easier for you all day to day. So like Amy mentioned, how do I get to a next slide? There we go. My name is Katie Henderson, and I am a third-year OT student at KU. And for my final semester of my coursework, I am doing a capstone project that's at Gilda's Club this semester. And it's focused on OT's role in cancer care. So that's kind of an emerging area of practice that I've been, kind of more interested in and become more of aware of the role that OT can have through some family members going through cancer treatment and family friends, things like that, and just seeing the role that OT could help to be able to facilitate participation in everyday necessary tasks. So I also included my contact information here, intern at gildasclubkc.org. So if you have any questions that weren't able to be answered tonight or would like to contact me in any way, feel free to just email me there. And I did want to mention, Amy talked about this for a moment, but I am holding OT consultation hours on Tuesday afternoons and Friday mornings over Zoom. And I'm just hoping to work with individuals one-on-one for more specific support on managing side effects of the cancer and cancer treatment that you might be having that get in the way of doing the things that you want and need to do each day. So I can help with, talking about different strategies, adaptive equipment, things like that from an OT perspective to hopefully help with your engagement in everyday activities. We can also work on goal settings and just creating goals and problem solving between different solutions and advantages and challenges with different solutions, and kind of develop an action plan to do what you really want to get back to doing that's important to you in your life. So again, you can email me at intern@gildasclubkc.org to schedule a session. So I want to start off just talking about OT's role in this emerging area of practice, and specifically with neuropathy. OT is just working to facilitate engagement in the daily activities and tasks that are needed and meaningful to individuals, whatever that might be for each person. So with neuropathy, OT can provide support through suggesting ways to regain lost abilities and sensation, strategies to help manage that, and ways to modify what you're doing, modify the task you're trying to do, or the environment, just to help with participation. So I did want to mention, if you are experiencing neuropathy, it's really important that you also inform your healthcare team. This information in this presentation is just on an OT's perspective, and there are, obviously a lot of different strategies and ways to help with management of neuropathy that your healthcare team can help give you, more information on. So an outline of what we're going to go through tonight. I'll just do a brief overview of what peripheral neuropathy is. We'll talk about important safety considerations and fall prevention, and then adaptations you can make regarding dressing, cooking and eating, personal hygiene, talk a little bit about exercise, and then a few alternative methods, and then equipment resources at the end. So what is peripheral neuropathy? We'll start there. I'm sure all do have an understanding of that, but just to get a baseline kind of background information, we'll just discuss it briefly. So it's, damage to the peripheral nervous system due to chemotherapy that's often treated in cancer. It can be referred to as chemotherapy-induced peripheral neuropathy, and that is what I'll kind of refer to it as the presentation goes on. And so, chemotherapy agents can work to kill cancer cells by interfering in the formation of new cells, which is why the normal cells are also still, impacted by chemotherapy. And this damage to the normal cells is actually, part of what causes the neuropathy. So it affects many nerves and is thus referred to as polyneuropathy. The areas most affected are hands and feet. It's the second most common acute side effect of chemotherapy, so it is very common. And then a little information about the prevalence of neuropathy after chemotherapy. 68.1% of individuals had symptoms of neuropathy at 1 month after chemo. 60% at 3 months after, and 30% at 6+ months after from one study. Let me see. Okay. And then I did just want to include different types of chemotherapy that are most commonly associated with neuropathy. So different chemotherapy drugs result in differences in the prevalence of neuropathy, as well as in the symptom, presentation, and progression. The information provided in this presentation is based on the most common side effects of neuropathy, but each individual has their own unique experience with neuropathy that's dependent on many factors, including which type of chemotherapy. So side effects of neuropathy. There are many different side effects. The sensory symptoms typically develop more before the motor symptoms, and it's referred to as a length-dependent neuropathy, which means that symptom progression is thought to begin in areas that are further from the body, so the fingertips and the toes, and then over time with more exposure to the neurotoxicity, the symptoms can increase in severity and move inward. And so we'll just start with the sensory symptoms. People may experience numbness, tingling, a burning sensation. They can have pain that's referred to as neuropathic pain that can be either caused by something that's like touched on the skin or to those areas, or it can actually occur without any external stimulation to cause that pain. It can be throbbing, jabbing, sharp, burning, and again, it can occur during activities that aren't usually supposed to elicit pain. So you can also have impaired sensation of touch, temperature, unable to sense hot and cold, and then also impaired proprioception, which is just the ability to sense where your body is in space. So individuals might not be able to really tell as well where their feet are without being able to, use their vision to look. So that can, cause some difficulties with walking, increased falls, things like that. And then just overall diminished sensation in these areas or extreme sensitivity. So also there are some motor symptoms to note. People can have some weakness, lack of coordination in falls, hyporeflexia, which is just like a slow loss of muscle response, like the muscles just being less responsive to sensory stimuli, just not as able to respond in that way. You could have muscle cramps or experience paralysis in the muscle groups that are effective. And then much less common, but worth noting, there are some potential autonomic symptoms of neuropathy. And the autonomic nervous system just refers to the nervous system that controls bodily functions that are unconscious, like the heart rate, breathing, digestion. So individuals with neuropathy might experience a heat intolerance, excessive sweating or inability to sweat, bowel and bladder problems, dizziness or lightheadedness due to drops in blood pressure and orthostatic hypotension, hearing loss, and tinnitus, which is the ringing in the ears. So these are less common, but I still wanted to note them as some people might experience them. Outlook. So symptoms of neuropathy can improve or resolve over time, but it is also not uncommon for the symptoms to persist sometimes for years after completing treatment. I know one study noted that 1/3 of individuals who received chemo had chronic neuropathy that lasted longer than 6 months, and another study noted that women approximately 6 years post-treatment, 47% still had some symptoms of neuropathy. So since it can persist potentially for many years, it can be considered a chronic condition that needs to be continually managed and monitored. And depending on the type of drug taken, you might experience progressive worsening of symptoms even after treatment's over. This is just why it's important to help learn effective ways to manage your neuropathy so that you can live your life to the fullest rather than just trying to wait until it hopefully goes away. So impact on life, I'm sure you can see how it could impact all areas of life, but specifically you may have some difficulty with your hands and holding and manipulating small objects, which could cause you to take a longer time to do just everything throughout your day. With your feet and the impaired sensation there. One might have difficulty walking and maintaining balance and postural control, which could also cause a higher risk of falls and injury. There's also potential skin injury that could happen in those areas. Just if someone's, not able to sense hot and cold as well, you could, accidentally hit your hand on a boiling pot of water and not, realize it as fast as someone who might have that intact sensation. So there's just some, potential skin area factors that we'll discuss in the next few slides. And then just overall, there could have a decline in function and independence in many different areas of your life, and just overall potentially reduction in quality of life. So this is just kind of an overview of neuropathy and why it's important that we kind of see if there are some strategies that can help us. So I'll move into safety considerations. First with skin integrity. So like I mentioned, with the impaired sensation, it's important to, look at your skin and make sure that you don't see any redness, warmth, scrapes, bruising, anything like that in those areas that you can't feel. You should try to look at your skin on your hands and feet, just anywhere that you feel that the neuropathy is affecting daily, for just all of those, things to look for that I mentioned on the slide: the redness, warmth, scrapes, cuts, bruising, things like that. It's also important to keep the skin hydrated through lotion and oil and through water consumption. Just the more hydrated that your skin is, the more elastic and pliant it can be. So just remembering hydration for sure. And back on like the daily skin inspections, if it takes longer for a part of your skin to return to the normal color, then you need to find out kind of what is causing that irritation and fix the issue. Just like, for example, with feet, if you're having diminished sensation in your feet, you might not be aware that your shoe is rubbing in the wrong way, and it could over time, cause injury to the skin. So just continuing to look at your skin daily and making sure that there isn't any potential injuries that could result. And in addition to treating the infected tissue, rest the infected area and try to just minimize the pressure on it or overuse of it in order to allow the healing to occur. But if you do notice any of these signs of skin irritation, contact your doctor immediately to just make sure that you continue to prevent and treat those the best you can. So going off of the visual inspections, I mentioned, looking daily at anywhere that you have impaired sensation. So often that's the hands and feet, because you want to make sure your skin remains intact. One way to do so is if you were to put a mirror under your bed and slide it out to look at the bottoms of your feet, or have a handheld mirror like I have on the screen here, something like that, to be able to look at the bottoms of your feet. Obviously, the bottoms of the feet might be one of the hardest places to look, a lot harder than looking at your hands. So developing strategies to make sure that you are checking the bottoms of your feet to make sure that there aren't any, bruising, redness, things like that is really important. And also, if you do have a family member or someone around that could help you with that as well, that would be beneficial. And early detection of skin irritation and injury is just crucial for healing and preventing the worsening of symptoms. So again, if you do notice any of these signs on your skin, it's important to contact your doctor. So specifically with hands, due to the impaired sensation within hands that one might have, someone might think that they need to grip items tighter than necessary. Obviously, like if you're just really trying to grasp something, you might accidentally grip it pretty tight, which over time could actually kind of cause some tearing of the skin or loss of blood supply. So we'll talk about different strategies to help gripping things more easily, but it's important to just remember to try to not grip items too tight, because you wouldn't want to accidentally hurt the skin or circulation in your hands. And then just when doing things throughout your day, a lot with your hands, try to avoid repetitive motions and friction on your hands, just thinking about, trying to make sure your skin stays intact and everything like that. You could wear well-fitted gloves or built up thicker handles on utensils to help with there to be less friction on your hands and just easily be able to grasp something better, which I'll talk about more in a little bit. But then also just thinking about taking breaks, changing the grasp that you have something in your hands, or even alternating it in your hands are other ways to help make sure your hands stay intact there. And then specifically with feet, due to the impaired sensation in your feet, you might not be able to sense pain or the feeling of continuous pressure on your feet in just one area. So like if we have sensation that's intact in our feet, we often, we'll switch our weight from one foot to the other. We might adjust our shoes or take off our shoes, sit down, things like that, because we notice that a part of our feet is hurting. But if we don't have all that sensation in our feet, we might not do those things. So it could result in an injury there. So if you're just walking around the house and anything like that, you want to make sure that you're wearing shoes or slippers that are really protective of your feet, just so that you don't, accidentally stub your toe or, any sort of injury to your feet. And you want to make sure your shoes do fit well so they don't cause injury to your foot from being too tight or just not fitting right, which is why, you have to continuously, daily look at your feet to make sure that it isn't rubbing the wrong way or things like that. And wearing socks with shoes can help with this as well. And then kind of like I mentioned, try to just not stand for too long or wear shoes for too long. Like the more you can change positions, change the pressure, less likely you are to have like kind of a pressure injury there. Okay, and then with temperature, we mentioned that with hot and cold, you might not be able to sense that as well. So there are some, strategies to help make sure that you do stay safe with temperature related things. Using thick silicone gloves when cooking, using the oven and stove, and even when taking food out of the freezer or dealing with frozen foods could be important to help prevent just extreme temperatures, and making sure those gloves are even up like past your wrist into kind of your forearm would be best, just because you might have, impaired sensation past your wrist as well. So just making sure you're covering the whole area. And with water temperature, there are actually thermometers that you can attach to sinks and showers. Those are the pictures that I showed there. And all of the equipment, including these that are mentioned in the presentation, will be sent out through a resource list to just show you where those can be purchased and kind of like the keywords to look at other places for those as well. But basically these specific ones have different colors depending on the temperature to tell you when it might be safe or not safe to put your hand under that water. So it is important to either have kind of a water temperature thermometer on. You could also use an area of your body that has intact temperature sensation to test the water before touching it, or if you have a family member around. So I mentioned on the side effects that orthostatic hypotension can be involved, and that's just a decrease in blood pressure when going from sitting or lying to upright standing position, and it can cause a loss of consciousness. And if you are experiencing this, it's important that you do talk with your doctor to learn about all the ways that you can manage this, as I'm just mentioning things that are from an OT perspective and could be helpful strategies, but aren't a complete picture of how to manage it. But trying to move slowly when going from lying and sitting and standing would be important, especially during the times like during the morning, after meals, or after using the restroom would be helpful. Trying to avoid prolonged standing as well as prolonged lying and just not moving as much throughout the day. Avoiding high temperature and humidity that can actually make it worse. So just trying to avoid that as much as you can. It was also noted that small and frequent meals could be helpful in the management of orthostatic hypotension rather than large and less frequent meals. And as always, hydration is very important, and it is important for management of this as well. And another strategy could be elevating your head 10 to 30 degrees while sleeping. So a few exercise safety considerations to just keep in mind if you have some symptoms of neuropathy. Try doing the exercise seated in a chair with back support and arm support as needed, just since, as I mentioned, with the impaired sensation that can be in the feet, you might not be able to sense where your feet are or just have adequate balance to keep yourself safe during exercise. So you can still get a great workout with being seated in a chair. And we'll talk about exercise at the end, but that could be, a best way to stay safe there. Also, when exercising, try to start slow and allow your body to adapt, and then gradually increase with repetitions and the time exercising, just to, know what your body can handle, and just really listen to your body's signs of needing a break, maybe feeling dizzy, lightheaded, exhaustion, trying to be really aware of how you're feeling while exercising to make sure you don't overdo it and, cause, a safety risk there. And hydration and nutrition, always important as well. So now we'll move into fall prevention. So if your sensation in your feet and legs is impaired, you might have difficulty sensing where your feet are when walking, which means you might rely heavier on your vision to kind of know where your foot is, to make sure you're taking good steps and things like that. And since your vision is heavily relied upon, it's important to just remember to, if you do have glasses or contacts, remember to have those on to see clearly when moving around your home and in the community. So just a little bit on the importance. In one study on a woman, approximately 6 years after cancer diagnosis, that had neuropathy, those individuals had a 1.8-fold increased risk of falls compared to those without neuropathy. And it studied just their walking altogether, and it showed that they were walking slower, had smaller steps, and took more steps. So it just shows that neuropathy does have an influence on walking and moving around, and that it can, make you at an increased risk of falls. So it's just important to, have a plan and be cognizant of ways that you can prevent falls so that they don't happen. So just for a minute, if you can just kind of think about a time you might have fallen in the past, and I'll just kind of read some questions for you to just kind of reflect on that, because if one does have a fall, just learning from the factors that contributed to that fall can help prevent it in the future. So if you have had a fall in the past, where did it occur? Do you remember what you were doing when it happened? What you were wearing? What time of day? What caused it? Is there any safety hazards in your home? Or did other side effects contribute to the fall? And then as you think about that, what solutions to prevent another fall from happening? What could you change in the environment so that you don't have that happen again? Do you need new footwear potentially, or manage other side effects? Or would an assisted device help you get around more safely? Is there someone that could help you solve it? And when can you solve it? So I know I went through all these questions really fast. I have a lot of material to get through tonight, but it's just really important, if you have had falls in the past, that you really kind of analyze what happened and reflect on that in order to, prevent them in the future as well. So one area of fall prevention is making some changes around the home to keep you safe. And I'm just going to briefly go over these, but there's a lot more to come in the home modifications program that I'm going to be presenting on February 21st. So come for that for more information. But obviously, removing unnecessary clutter on the ground will really help to reduce any risk of falling. Increasing lighting, like I mentioned, if you have impaired sensation in your feet, you might rely on your vision more to see where you're going and know where your feet are when you're walking, things like that. So lighting can be really important. You can add lighting, to the bottom and tops of stairs, or the beginning and end of a hallway, things like that. Automatic lights can be put in, or it can be important to really add lighting from your path from the bed to the bathroom at night, things like that. Remove unnecessary rugs. Rugs can be a big fall hazard. I know that some people, think that they might be needed in certain areas. So if they are needed, make sure that they're secure on the floor. You can get non-slip kind of tape backing to make sure that they're really secure on the floor. Remove any cords. In the bathroom, we'll talk about it more, but installing handrails or grab bars, putting non-slip strips or rubber mat in the shower bathroom, like adhesive strips on the bottom of the tub, or a rubber mat that's really suctioned to the bottom of the tub can be really important. We'll discuss shower chairs, and even a handheld shower head can really help as well. Shoes. So it's important to wear shoes that properly fit so that you don't hurt your feet, but then also shoes that don't put you at risk for falling. Having good traction, rubber soles on your shoes are important, as well as like inside your shoe having a supportive insole for arch support, but then also ones that have cushion. And again, like I mentioned, just wearing shoes around the home is helpful. So briefly, I just wanted to put a few different mobility devices on my presentation, since if you have neuropathy and you might have difficulties with balance and weakness in your feet and legs, having a device that could help you get around could be beneficial, just to safely move in the home, or you could even use one just in the community, whatever you think might be best for you. So I won't go into detail with these three. These are just some examples to inform you on options that are available. If you think you would benefit from a mobility device, seek professional assistance. An OT or a PT can help with specific recommendations that fit your needs, and they can help with training you on use for that and things like that. But this is just an overview of what's available. So now we'll move into adaptive equipment. I can't guarantee that any of these pieces of equipment will work for you. These are just some suggestions that could help someone who experiences different side effects of neuropathy. And like I mentioned, all this equipment will be included in a resource that will be sent out to you on email after. So first, built up handles. So if someone is experiencing kind of weaker muscles in their hands, and if you feel like you might have trouble holding on to things like utensils with eating or with writing or just really anything throughout your day, you can get built up handles that can be put on to different utensils, toothbrush, hairbrush, eating, cooking, all those different things. And just something with increased surface area helps with being able to grasp it. So you don't have to, use more of your muscles to have a really small grasp on something. If it's bigger, it makes it more easier to hold, as well as like a friction material can help reduce the force needed to maintain that grasp. So there are a lot of different options for built up handles that are included in the resource list, but these are two that are some options as well. Also, for having a weaker grasp, you could use a universal cuff. This is typically if you have a weak grasp that maybe a built up handle you're still having trouble with, because this universal cuff, as you can see in the photo, you just kind of put whatever utensil in it and then you can slide your hand in it, and it really doesn't require much grasp at all. So yeah, there are different types of universal cuffs, but these are just a few. So dressing adaptation. So as I mentioned, neuropathy can affect your ability to use your hands and fingers to manipulate small objects, and a lot of that is needed with dressing. So I have a lot of different pieces of equipment that we'll go through that could be helpful. This first one here is a button hook and zipper pull. So one end is the button hook that, as you can see in the right picture, you kind of slide it through the opening and it can wrap around the button, and then you just turn it to go through. So you can use it to button and unbutton. And I have a YouTube video here. I'm not going to play it just because I don't want to run out of time, but again, these will be on the resource list, and you can also look up on YouTube kind of how these work to get a better feel for how it will work. But also, again, I'm available to meet with you one-on-one as well to help with anything, but also if you need help with kind of buttoning. But on the other side of a button hook is a little zipper pull, the little hook there, so you can kind of put it through your zipper and zip up and down. So that's one option. Another option for zipping is if you could loop a piece of string or leather lacing, anything like that around your zipper, just to create a bigger loop. That way you can just loop a finger through to go up and down with the zipper, and you don't have to use like a smaller grasp with your fingers to do that zipping. That's another option. I found these magnetic button shirts. So if you just feel like buttoning might be too difficult, there are other options at magnaready.com. There are these shirts that don't require any buttoning. They are just magnetic. And they have a lot of different options, so that is something to look into. And so as I mentioned, I have a family connection. My uncle has gone through cancer treatment and has had neuropathy. So I've talked with him about, some of the difficulties that he's had in his life. And this is actually a picture of his pants. So we've kind of problem solved different things. And he was actually able to put some Velcro on the different sides of his pants to Velcro it closed instead of using a button. And it really looks like you buttoned your pants, like it looks completely great on the outside. That's just kind of another idea if that is interesting to anyone. There's also different belt alternatives so that you don't have to kind of navigate putting it through there. This one is called an Adult Myself belt that you kind of wrap around, and then it has kind of like a Velcro snap part of it as well. So that could be helpful. And then jewelry, obviously fastening jewelry requires really small movements of the fingers that can be really difficult. So there are some different equipment pieces that I found on the right stuff. And this will all be linked in that resource. But as you can see on the left here, there's a Dynatomy Easy Living Bracelet Assist that just helps hold the bracelet on your arm as you attach it. Magnetic jewelry clasps are another option that you can put onto your jewelry. This is another option. It's a hooker bracelet helper. So one side of it's actually a button hook, like we already talked about, and the other side has a little kind of almost clothespin looking thing that you can attach to one end of like a bracelet and then keep holding it in that hand so that it stays where you need it to go while you attach it with your other hand. So just a few options. Sock aids. If you're having trouble with kind of navigating socks, getting on and off, there are a few different options with sock aids. Basically, with all of these, you put the sock onto the device, and then you either hold the rope part on the top left or the metal part on the other ones and kind of like push your foot through while you pull up with your hands. So if you notice just difficulty navigating, getting socks on with your hands, these are an option. And then for shoes, tying shoes could be pretty difficult if you're having trouble with coordinating your fingers due to the neuropathy. So there are lots of different options. Slip-on shoes would obviously be very helpful. There also are lots of different Velcro shoe options available that still look adult-like. And then long-handled shoehorn that I have pictured in the bottom right can be a helpful tool for a lot of people when putting on shoes. And then there are many different options for laces so that you don't have to tie them. So there's this one in the middle where it's these elastic laces that you actually just kind of put them on all of the different holes there and you don't have to tie them yourself. And then on the left here, there's another elastic lace option where you just kind of pull it tight. So just some shoe options to think about. And now we'll go into cooking and eating adaptation. So if you have impaired sensation in your fingers and hands, there's more risk of cutting yourself. So we'll first start with safe cutting. So on the left here, the rocker knife, it allows you to cut things with just using one hand, and you don't have to have that strong of a grasp to do so, because you can just kind of push down and kind of move it back and forth. And that can be helpful there. The finger guards can help protect your fingers while cutting, because as we mentioned, if you have kind of impaired sensation, you might be at a higher risk for cutting yourself and not necessarily realizing that you've hurt yourself with a knife. So it's important to take some extra precautions with cutting. And then I did find this cutting board on the top right. That's pretty cool. It has suctioned things on the bottom so it can really stick onto a counter. And then the pieces on that corner there can keep the food in place so that it doesn't kind of move off the cutting board and you don't have to use your hands as much to keep it in place. And then those food spikes there can be helpful to just put your food in it and then allow yourself to just cut while it stays in place with that. Jar openers, obviously jars can be really difficult, especially with a weakened grasp. So there's jar grips, there's this in the middle, the every hold easy twist that can fit onto all different sizes of jars. And then just an electric jar opener would also be an option.
Sorry, just really quick, I wanted to interrupt. Can we all just double check and make sure we all have our mute on? And so that's all I wanted to say. All right.
Thanks.
Go ahead.
So then some just other helpful equipment that you might have not thought about. Electric can openers can help, so you don't have to navigate just doing that manually. A food processor or an electric chopper can help with cutting up foods. And then I mentioned before, but having some thick silicone cooking gloves can help to protect your hands when dealing with really hot and cold temperatures, and knives, things like that. And there's also these silicone dishwashing gloves that can make it easier to wash dishes, like protect your hands, and then also make it so you don't have to hold so many different things when washing. You could just use the gloves to help with that. So more equipment, just things you might not know that's out there. Automatic pot stir could be used so that you don't have to, stir a pot yourself. There's a suction scrubber that can just attach to the side of your kitchen sink and just help free up your hands more when washing dishes. Also, a non-skid cooking mat can be really helpful to keep things in place when cooking so that they don't move as much, and so you don't have to use your hands as much to keep things in place. Another thing to mention, just wooden utensils might be best to use when cooking rather than metal ones, since metal ones can keep heat in more easily, and that could, since you might have impaired hot and cold sensation, that could, be just like a risk, a safety risk there. So then specifically for eating, if you're kind of having trouble with coordinating the movements to just pick up food on your plate, a plate guard can help. And as I mentioned, large handled utensils can be used for eating, and another non-slip mat that can be used for cooking, but also helpful when eating. And then drinking, another temperature specific recommendation, if you use an insulated mug rather than a ceramic mug, it can help with not being so hot on the outside, because you might not realize how hot a mug is, but it could just be easier to use an insulated coffee mug. And then also a cup that has a handle can require you to not have to use your grasp as much, and it can just kind of be easier so you don't have to think about it and things like that. So there are actually these like adjustable handles you can put on any type of cup, or you can just try to buy cups or glasses that have the handle there. Other just cooking, eating related tips, if you were to buy pre-cut foods instead of cutting them, that could be easier. Move commonly used items to easier to reach areas to minimize bending and reaching. Long-handled reachers can help to grab lower items to avoid bending. And you can also bring a chair to the kitchen while cooking to make it easier and just keep your energy throughout cooking. And then if you want to try to gather all ingredients before you start cooking, that can also be easier. And try to slide items across the counter instead of lifting them. And then just listen to your body. If you're feeling fatigued, take a rest break, and maybe even cook in different chunks so that it's not all at once. So now we'll move into personal hygiene. So there are built up grips and like universal cuffs that you can use with different aspects of personal hygiene. So you can put them on hairbrushes, toothbrushes, things like that to make things easier. And I also found this nail center thing that can be helpful so that you don't have to kind of navigate it with your fingers. You can kind of push down as it has that suctioned piece there. And then bathing, there are a lot of different things to discuss with bathing, and more will be discussed in the home modifications program. But in order to prevent falls, adding some anti-slip tape or like just some non-slip bath mat in the shower is important, but just making sure, I mean, with the tape, it's pretty secure on your bathroom tub, but with a rug or like a mat, making sure that it is really suctioned good onto the bottom of the tub is really important. And then if you have to have a non-slip mat outside of the shower, it's important to make sure that it is a non-skid mat. And also, the more thin it can be, the less risk of it causing you to trip and fall. And then another idea to prevent falls even more in the bathroom, if you're not using your bath mat outside of the shower, like after you've showered, if you just put it up when you're not using it, that can help just minimize the risk there. And then continued. So these are just some options for shower chairs, and then tub transfer bench if you use a tub, but it can be beneficial to use a chair in the shower to help with balance, since balance can be impacted with neuropathy. Just to make sure that you stay safe in the shower, there are different options for these shower chairs. And we can discuss what is best for your unique shower and your situation if you want to contact me individually as well. This is just kind of an overview. And then other helpful pieces of equipment in the bathroom, grab bars can be really helpful to have inside of your shower as well as outside. You really want to not grab onto any sort of towel racks or even the bathroom sink, because you wouldn't want it to like come out of the wall or something like that, depending on your situation. So if you notice yourself kind of grabbing onto the walls or things like that in the bathroom, installing your grab bar is something that can be really helpful and would be helpful for you, for the rest of the time that you're using this shower. It's not just specific to neuropathy. Handheld shower head, again, that can make things really easier for you. And even a shower mitt glove that I put a picture on here, that way you can kind of not focus on holding a loofah or whatever you use to shower. If you have it just kind of on a glove, then you don't have to worry about being able to grasp something like that. And then also, it was cut off a little on here, but if you have shampoo, conditioner, and soap pumps, that can be easier than having to like squeeze a big container of that. Additional adaptive equipment, I just added on here. I found some different ways to help with turning keys. So if that's something that's more difficult for you, this will be on the resource list, but ways to turn keys easier. And there are also other pieces of equipment that I couldn't include in here. So if there are other areas that you're having difficulty with, we can work together to problem solve new strategies, new equipment to use if you contact me. So don't have a ton of time. We'll go into pain a little bit. So pain can be a part of neuropathy for some individuals, and it's neuropathic pain that we kind of talked about in the overview, but it can be burning, tingling, shooting, feel like an electric shock or just numbness, and it can contribute to changing the patterns and routines that you have throughout your day. It can cause or contribute to cognitive changes, sleep changes, emotional changes, appetite change. Just it can really have an impact on your daily life. So it's important to talk to your doctor if you're experiencing pain, definitely, because there are pharmacological interventions that are available. And I'm just speaking to specific OT recommendations, but yes, so definitely contact your doctor. But some strategies that could help with pain, exercise specifically for muscle strengthening and balancing has shown to be effective in reducing neuropathy pain and increasing quality of life in those with chemotherapy related neuropathy. Relaxation training in the form of diaphragmatic breathing, progressive muscle relaxation, visualization, guided meditation. They're all just could be beneficial in treating chronic pain. And I did want to mention that Gilda's Club does offer guided meditation monthly. So if you are experiencing pain, this might be an area to look into. And then mindfulness has also been shown to be beneficial for treating chronic pain. Yeah. So now we'll move into exercise and things I've found with exercise and how it relates to neuropathy. So in one study that I looked at for individuals with colorectal cancer treated with chemo, Not meeting physical activity guidelines was associated with more severe neuropathy symptoms. And those that did have more neuropathy symptoms, they did experience worse functioning in physical, role, social, emotional, cognitive domains, and they also had a greater fatigue, nausea, vomiting, dyspnea, and financial impact than those that had the lower neuropathy severity in this study. But it was noted that regardless of any neuropathy seating symptoms not meeting the physical activity guidelines, didn't mean to do that, had just lower scores in all of these areas as well. So that's just kind of one study. And then another one here looked at individuals that were going through chemo. If they engaged in 6 weeks of aerobic and resistant exercise, they had a reduction in their neuropathy prevalence and severity. So they had a decrease in numbness, tingling, hot and cold sensation in their hands and feet. And this was with a home-based exercise. So it involved moderate intensity daily walking and TheraBand exercises that both got progressively more difficult as time went on. So this just supports that more physical activity engaged in and the greater muscle volume is associated with less severe symptoms of neuropathy. So in many of the studies I looked at, there are different theories and possible reasons why exercise is beneficial for neuropathy. So I just wanted to include some of these that were from these studies, but exercise reduces chronic inflammation of the body, which can be connected with neuropathy. It also improves blood circulation, which may move the chemotherapy away from those sensory neurons. It can reduce nerve hyperexcitability, promote nerve repair and regeneration, forming new blood vessels. It can reduce other cancer-related side effects that occur along with neuropathy. So just have many beneficial effects there, and could potentially change brain's processing of sensation. And it also was noted that exercise may treat neuropathy symptoms better in older adults. So I'm going to kind of move through the last part of this a little quickly so we have time for some questions. But there was some research to support Tai Chi for improving strength, balance, stamina in older adults with neuropathy. And also there were benefits in physical, social, emotional, and functional well-being. And just noted that there are many seated Tai Chi videos online that I've found that you can look up as well. And then also there are Tai Chi class options that are offered on an ongoing basis at Turning Point. Yoga has also shown some benefits with neuropathy specifically, and a study found that with individuals with breast and gynecological cancers, it reduced anxiety with the symptoms of neuropathy. And there are some other benefits there. I'm going to try to kind of move past through this a little fast here. But yeah, with exercise, there are some studies that showed mixed methods of approaches to exercise, such as one that had individuals post-treatment had either endurance and balance training or just endurance training, and benefits were found with both. Endurance was shown to have more reduction in the sensory symptoms of neuropathy, whereas balance was more the functional status. And in another study, stage 4 colorectal cancer, those individuals that participate in 8-week multi-method exercise that include resistance, endurance, and balance training, they found significant improvements in their balance and strength when compared to a control group. So those are just many different studies I looked at. Obviously, there are some benefits that come with exercise for managing neuropathy symptoms. Specifically supervised exercise, including balance, resistant, and aerobic exercise of low to moderate intensity has been found to be safe and beneficial in treatment of neuropathy. Just generally, rest is best kind of used to be more of the thought process with cancer treatment. And obviously there are situations for everything, but generally it's no longer as evidence-based. Just the more that you can get up and moving safely, after, consulting your doctor about what's appropriate for your specific situation, that can just be really beneficial. So again, seek professional guidance before engaging in any exercise, because I don't know your unique situations, but once you talk with your doctor, any sort of exercise that they say is appropriate would be beneficial to engage in. So again, keep in mind safety implications with neuropathy and how to be safe, such as sitting in a chair, just starting slow, and listen to your body's signs of needing a break. Quickly, alternative methods. There's more research needed in these areas, but I thought I'd highlight some things that I did see. If you're interested, talk with your doctor first, but acupuncture, massage, and foot bath have shown some benefits with treating neuropathy symptoms. So again, if you're interested, you can talk with your doctor more. So like I mentioned, all the resources of the equipment that I included will be sent out in the follow-up email. So you can click on that. It's not an exhaustive list. Like I have a link to one, specific grab bar, but there are a lot of grab bars out there and different ways to get them. I listed some here: Accessibility Medical Equipment, Missouri Assistive Technology, Kansas City's Medicine Cabinet. They have resources for getting equipment like this. But again, so it's not an exhaustive list. If you have specific questions, please, email me and we can talk about it more. But more equipment related suggestions will come in the home modifications program that I have on February 21st. So yes, here are all my references. I looked through a lot of different things. So here are them, and then the picture references. But we can go ahead and go into questions if anyone has questions, or if you'd rather contact me, there's my email again, intern@gildasclubkc.org. I can answer your questions or work individually with you if that's something you'd be interested in. Thank you all for coming to this program. I hope you may have found something helpful here. I know I'm a really fast talker, so sorry if that was very fast. But I might stop sharing my screen now and